Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. When you hear the word concussion, you probably think of athletes, but another often overlooked population prone to repeated concussions are domestic violence survivors. An estimated 1 in 3 women and 1 in 7 men in the U.S. will experience physical violence from an intimate partner in their lifetime. So today, we're talking about a specialized neurological program that gives VIP treatment to domestic violence survivors. With Dr. Javier Cárdenas, director of the Concussion and Brain Injury Center at the WVU Rockefeller Neuroscience Institute. Welcome, Dr. Cárdenas, to Live Healthy West Virginia.
Thanks for having me back.
It's great to have you here. So, October is Domestic Violence Awareness Month. And many, I didn't realize, I kind of realized this, but, many domestic violence victims suffer from repeated concussions. So let's just do a little refresher on what is a concussion or a traumatic brain injury.
Yes, so a concussion is the mildest form of a traumatic brain injury, which represents an impact to the brain and a change in neurological function. So, for example, if somebody is struck, as in the case of domestic violence, or they fall, which is actually the most common cause of a concussion, or they're in a car accident, or they're in a work-related injury, or they're in a sport-related injury, when there's an impact to the body or the head that causes loss of consciousness, which is the most obvious but not the most common, a gap in memory, confusion, dizziness, vision change, that represents the mildest form of a traumatic brain injury, a concussion.
And I can imagine if this has happened repeatedly to people like domestic violence victims, which, by the way, I noticed your purple pocket square. Tell us about that.
Yeah, so October is Domestic Violence Awareness Month, and the color is purple. It's not necessarily a mistake that this is in the fall. There are many comparisons of sport related to concussion to domestic violence, but there are clear distinctions. I think a big misconception about concussion is that it is most common in athletes, and that actually is simply untrue. It's actually most common as a result of a fall. But because sports, especially football, get all the attention, they think, oh my gosh, there's all these concussions, and they have short-term consequences and long-term consequences, when in fact, what's happening in our backyard is all these concussions that are happening to domestic violence survivors.
Wow. This is a heartbreaking topic. It really is. But we need to create awareness, especially since this is Domestic Violence Awareness Month. How common are repeated concussions among domestic violence survivors?
Well, again, when we've been talking about sports, we hear all the big news. Oh, this individual's had 3 concussions. They've had 4 concussions. They've had 2 concussions in the same season. When we did a study of domestic violence survivors, the most common response to how many concussions they had was too many to count. They had lost count. So this is a repetitive head impact. These are repetitive concussions that are happening to these domestic violence survivors. In many ways, it is not unlike what we used to see in our yesteryear athletes, the ones that we hear about today that are suffering from degenerative diseases of the brain because of repetitive head impacts. This is a lot like what we used to see decades ago.
Oh my gosh. And I imagine they're too many to count, but they're probably going untreated, aren't they?
They are going untreated. And what's also interesting is when they present themselves, many times providers, physicians, and others will focus on domestic violence, on keeping them safe, on the social aspects, which is perfectly fine and understandable. However, at the same time, these individuals need treatment. And the most common symptom that they complain about is headache. Well, guess what? The most common symptom any concussion survivor complains about is headache, whether that's from a sport-related concussion, a fall, a motor vehicle crash, etc. And headaches are treatable. And so are the other aspects of concussion, such as cognitive problems, memory problems, such as balance problems, such as vision problems. All these things are very treatable. They happen in our domestic violence survivors more so than in our general population, but they can get the same help, if not better, for their injury.
What are the dangers of going untreated, having these many concussions and going untreated?
Well, if you look at the sport-related concussion literature and you have individuals who have a concussion and then they do not have a full recovery, they can suffer a second concussion, and that can result in brain bleeding and swelling, which is incredibly rare but happens every year. More commonly is they are compounded, meaning that the headaches, the dizziness, all the things that come from that first concussion, and then there's a second injury, those symptoms go through the roof. It takes them longer and longer to recover, and so they suffer more, and they are more likely to have permanent or long-lasting problems.
Oh, wow. That's just terrible. So let's talk a little bit about, you said, there is treatment available. Now, we have this special program at the Rockefeller Neuroscience Institute at the Brain Center. Tell me about this. What is this program and how does it work?
So the DVIP program is built upon our multidisciplinary comprehensive brain injury clinic. In fact, we were recently awarded a grant because we have the most comprehensive brain injury program in the country. And by that I mean we address the physical, the behavioral, and the cognitive deficits associated with concussion and brain injury. So we have 2 neurologists, 3 physiatrists, which are physical medicine and rehab physicians, 1 psychiatrist, 1 psychologist, 2 neuropsychologists, one of whom is pediatric dedicated. We have 2 occupational therapists, 2 physical therapists, and a speech therapist, all as part of the program. We are 13 members strong. And so we are able to deliver the absolute most comprehensive care for all of our brain injury patients. So that is the base that we are working with. Now, beyond that, the DVIP program was built off of concierge programs that we see around the country. Now, these are for individuals who have financial means that typically will call a hospital, they'll speak to a nurse, and they will provide kind of a red carpet approach to their clinical care. Now, what happens is as soon as a patient is identified as suffering that or a previous head injury as a result of domestic violence, then their schedule is curated. So our scheduler, Brandon Cool, will work on their schedule, will organize it for their purposes, for their means. They get a tour of the facility, just like other VIPs that come to visit us do. They have access to our float tanks and our light therapy that other patients do not, and they will always get that for free. And then they go down to our cafe, and then they have a free meal for them and or their families every time they come to see us.
Wow. So you guys have thought of everything. I mean, you're covering everything. But my question is, if so many of these go unreported, how do you reach the people that need these services the most?
There are lots of ways in which we try to bring people into the program. It is a clinical program, so that is something that's important to note. So it is based on those who have insurance, and we recognize that not everybody has insurance, and that for those who have insurance, they can be underinsured, and so we try to work with those individuals as much as possible. But we partnered with the domestic violence shelters around the state, and specifically, we are working with the Coalition to End Domestic Violence here in the state of West Virginia in order to find ways to get these patients in. We also work with the Centers of Excellence in Disability at WVU. They have a brain injury program, and they have people throughout the state that help to bring people in. It's wonderful because the Coalition Against Domestic Violence in West Virginia has been a great partner in this program, and we're very intentional to be very small at first, make sure that we are fulfilling our commitment to the patients, to the shelters, and then bringing in more individuals and providing the best care possible.
So if someone is watching this and thinks, this is something I need, I could use, how do they sign up for this program?
Yes. So just like any other patient, they can go to the website. They can call the main line for the hospital or for the Rockefeller Neuroscience Institute. They'll talk to Brandon, and Brandon will prioritize these patients. These are our top priority patients over any other patients. And I'll tell you, one of the most fascinating and humbling aspects of this has happened on more than one occasion. We will have a professional athlete that we are treating, and then providing the absolute best care to them. The very next patient is a domestic violence survivor who, in many cases, does not have a home, does not have a place to live, and yet we are providing the same exact care, arguably better than what we do for our professional athletes.
Wow. You really have thought of everything. Is there a way that this is done confidentially? Because not everybody leaves their partner to get treatment. So
Absolutely.
How do you handle those situations?
It's not easy, but we also don't pass judgment. So, for example, if somebody has left an environment of intimate partner violence and they become part of our program, they are always part of our program, even if they go back to their abuser. We have to be incredibly careful because in my early days of doing this work, I was naive and thought, well, we'll just have them come on a specific day. Well, that's easy targets for abusers. So they are fully integrated into our program. And then they also have great points of contact. We've recently hired a social worker for when we get into some of those binds and challenges where we need outside resources, such as housing. This is not our wheelhouse. Our wheelhouse is medicine, such as other social services, such as food services. Again, not our wheelhouse. But we are looking at ways in which we can enhance the VIP experience for these patients. For example, we have one member of our team who is partnered with one of the makeup companies to provide a gift bag for every one of our DV survivors to take home, and also offer to help to show how things are applied and be a resource for them should they need it.
Wow, this is just wonderful. Now, how long has this program been around?
This program has been around since the Neuroperformance Innovation Center, since the Traumatic Brain Injury Clinic has been around, which started in January of 2024. So
how's it going so far? Do you have a significant number of clients or patients? I don't know what's the best way to refer to them? I guess they are patients, right?
They are patients. And so for the shelters, they're often clients, but for us, they're patients. And again, they are our VIPs. And so we are sitting around between 40 and 50 that we've taken care of, that we've treated. And there are more, of course, that are coming every day. We are very intentional about speaking about this. We're also very thoughtful of when we talk about this in our community, in part because we know that in general, when we discuss these things, our community likes to hear from other patients. But we have to be incredibly thoughtful for this population because their abuser either needs to be dead or incarcerated indefinitely. Otherwise, they have a target on their backs.
All the time. Yeah. But are you seeing success stories? I'm not asking you to give anything away, but I mean, it's been, 9 months that the program's been around? I mean, are you seeing success already?
Yeah, we are. So in just over a year, we have treated a good number of patients, nearly 50. We have provided, again, as VIP experience that we can. In fact, our goal is to exceed the concierge experience. And I will tell you that when I talk about this, And I try to get other colleagues involved. I let them know that, our goal is to have more DVIP patients than we have those who are come because of financial means or otherwise, or influence.
Right.
And so that's really important for us to do our good work. And the great thing is, many of the staff fight over who is going to give this new patient, this new VIP, this DVIP a tour, who is going to show them around. And it's wonderful. It really is humbling to be a big part of this program.
I imagine it's very rewarding for you and your team as well.
It's incredibly rewarding. And this is one of 3 community outreach programs that we have. The second is a youth sports program in which we are providing education, helmets. We are providing baseline testing. We are really doing a lot in that community as well. And then there's our first responder program because they have higher risk and rates of head injury. And so we really want to take care of these people who are out in the field, taking care of us in emergency situations.
I never thought of that. Really, the first responders are at risk, more risk for concussion as well, right?
They are, and are also shift workers, and so they can be sleep deprived, and then even have a greater risk of a head injury from either a combative patient, a confused patient, or they are struck by an object that falls off of the truck, and they need to move very quickly, and so they're in an outside environment many times that is not exactly ideal for taking care of people.
Well, you did earlier mention the Neuro Performance Innovation Center, the NPIC. Can you talk a little bit about what the mission is of the NPIC, and then about the mission of the DVIP program? Look at all these letters, right?
Yes. So our mission is not unlike the WVU mission, which of course is a land-grant mission to take care of all of our community. The vision for our program is actually to have a national recognition, national reputation, but that community commitment. And the great thing is we have already achieved that national recognition for the Neuroperformance Innovation Center because of our comprehensive clinic. So there are 3 elements. One of them is a injury prevention component. And so here is where we are trying to keep people safe. We're trying to avoid head injuries. And one way in which we do that is we have a gait lab, and we can measure and assess balance and as well as gait and abnormalities and preventing falls. Again, the number one cause of a concussion and brain injury. Yeah. And then we have our core, our bread and butter, which is our clinic, our comprehensive clinic, 13 members strong, in which we provide the most comprehensive care to our patients. And it's really important to note that there are places around the country that will say that they have a multidisciplinary or comprehensive program, and they'll say, yeah, we refer to this person and this person, or this person's in that building, this person's in that building, or this person's on that floor. We are all together. We are all together physically on Tuesday afternoons and Thursday afternoons, and so that is what we call our synchronous concussion and brain injury program. And then our asynchronous is we have many of the team members there throughout the week, but it is not when we have all hands on deck and providing that wraparound care. So for patients who come to see us, it is a one-stop shop for brain injury care. And then the neuroperformance aspect of the program is taking everything that we have learned about concussion and brain injury and applying it to performance. So for example, when we are doing rehabilitation for vision, in fact, when I was in Phoenix, we would have professional athletes who would come to us. They'd have a concussion. I'd send them to our incredibly talented vision therapist, Amanda Miller, and they would say, gosh, I really wish I had this information. I really wish I did these things before I got hurt, because then I could have prevented an injury. Well, and then it would come back in the off season, and they would get this therapy. And then we started going out to the professional organizations, professional teams, and teaching them how to do these things, but we had not studied it. So now we're studying it. We have incredibly talented researchers led by Hayden Daywig, who will look at balance, vision, cognition, sleep, and mood. And we do these things at the beginning of the season, and then we track them throughout the season, especially with sleep and mood and behavior, and then we can predict when somebody is not going to recover very well, and then we can also intervene. So for example, we see a lot of asymmetries, and remember, these are healthy people.
Yeah.
You see asymmetries in your eyes and in your vision that you normally wouldn't think are there, but with these analysis, we can detect them.
Wow.
And so in the off season, we work on the weaker side. And then in the regular
Ah.
season, we augment and you could argue, exploit the stronger side. So we can tell coaches, say, hey, this person is going to be best in this position at this time based on the neurological analysis that we've done.
Wow. I've said this a million times. The Rockefeller Neuroscience Institute blows my mind on a regular basis. I mean, and this is just another example. I mean, at all levels.
It's a great place to be because there isn't anywhere in the country that would let us do this, number one, and support us in doing this wonderful work. And it's really important to note that while this is a national program, meaning that it is an example for the nation, the dedication is to West Virginia and our community members.
Are you getting interest from other areas of the country saying, hey, we want to do what you're doing? How do we do this?
We have people who come to see us from not only around the country, but around the world to see us.
That doesn't surprise me at all. We did talk about how domestic violence survivors can sign up for this program. What can you tell, a domestic violence survivor that may be, watching or listening to this podcast and thinking, oh, I'm too afraid. This is going to make my partner really angry, and it's just going to make things worse. What would you say to those that may be hesitant that are listening to this to help reassure them?
First, I would say we're here to help you, and we're here to help you at any time. If now is not the right time, that's okay. There are many people that think, well, if I don't seek help now, or I don't get therapy now, or I don't take this medicine now, that all options are lost. That's not true. Are there better times than others for care and rehabilitation? Yes, there are. However, it doesn't mean that you lose an opportunity if there is a delay in the treatment. We can still provide the care. It might be harder, but we can still provide the care that each and every person needs, especially our domestic violence survivors.
What if there's a loved one that's, maybe has a relative or friend that is in a domestic violence situation? I know we have to be careful of HIPAA, but
of course.
What can those people do if you have a relative or friend that they want to help, that they think would benefit from this program?
Yeah,
what would you say to them?
We are available. We are very discreet in the work that we do, however people come to see us, which, by the way, when we talk to them about this program, it's an offering, meaning that once they've been identified and we say, we have this program, would you like to participate in this program? And there's no obligation. We have the obligation to our patients. We have the obligation to our domestic violence survivors to provide the absolute best care in the kindest way and the most secretive way, if necessary, but most discreet way, always.
Okay, good to know. Is there anything else we need to know about this program that I haven't asked you about yet?
Well, overall, again, this is the time of year when we're talking about concussions in the fall sports, especially football. So let's for a moment make a comparison of football-related concussions to domestic violence injuries. So first off, there have been papers written about the age of first exposure, and if you are exposed to concussion in a sport, then you are more likely to have a bad outcome as an adult. Well, if you look at football, for example, the most common age of first exposure is in adolescence, high school, sometimes in middle school, but often in high school. And that's it. That's the only exposure. Guess what? For domestic violence survivors, the majority of them, their first exposure to domestic violence is in childhood, and it continues through adulthood. So they have a lifetime of exposure. That's number one. Number two is you look at the season. The season, of course, for football is the fall. The season for domestic violence, year long, always sustained.
Yeah.
There is no concussion protocol for a domestic violence survivor, meaning we have programs for all athletes. If there's a suspected concussion, we remove them from play. And then after that, they have to go through a rigorous process in order to return to play. That doesn't happen for domestic violence survivors. And there's one crucial element that is entirely absent from sport-related concussion that is present for our domestic violence survivors, and that is strangulation. Strangulation, choking,
Wow.
is a common occurrence in addition to the head impacts. And so that decreases oxygen to the brain. And we know it only takes seconds for somebody to have a seizure as a result of this, for somebody to lose their bowel function, to lose their bladder function, and then, of course, in extreme cases, to die. And so it's many times after that occurrence, in addition to the head injuries, that we see these patients. And so they're incredibly special to us, and it's important for us to talk about that in this context. And I thank you for allowing us to share this very important information to not just our community of domestic violence survivors, but to all people who encounter this. I mean, this is many times just one degree of separation from somebody who's encountered domestic violence.
What would you say to a domestic violence survivor that's been through everything that you just described to me? It's just heartbreaking. It really is. What would you say to them if they think, I'm too far gone? You know, they can't help me. I mean, this has happened to me 100 times. They can't help me.
It's never too long. And in fact, what can also be humbling is when we see these individuals and we take care of, again, just like with any other patient, we take care of the person across from us. Sometimes we need studies of the brain, MRI, and when they're normal, we can celebrate that, meaning that there's no permanent scar from all those injuries. When we do neuropsychological and cognitive testing, if we can demonstrate normal neurocognitive function, we also celebrate that. And if any of these things are abnormal, then we treat them. We treat the symptoms, we treat the patient in front of us, we treat all aspects of the injury.
Okay. So talk to me a little bit about, I mean, I know we've talked about this before, but let's just remind people about what a gift it is to have this institution. I always say, not in our backyard, it's in our front yard. I mean, you guys are doing amazing things. Talk a little bit about the depth of experience, and I mean, you're world leaders on so many levels. Talk about RNI and the depth of experience and your team in particular for this DVIP program.
The Rockefeller Neuroscience Institute at WVU Medicine is a really special place to be. There's no other place like it in the country, and I would argue there's no other place like it in the world. And that is because the leadership has really emphasized the importance of excellence and making sure that we are doing our West Virginia community and patients right. So that is all the way from the top, Albert Wright. That is all the way from people like Mike Grace, Mike Edmond, Ali Rezai, Clay Marsh, every single one of them. My direct report, Dave Watson. All of these individuals are dedicated to our community. They are dedicated to the Rockefeller Neuroscience Institute. They know how important it is to be a leader in this space for the country, but at the same time to make sure that we are doing our West Virginia population right.
That's excellent. That's excellent. So before we go, what's the most important thing you want our viewers or listeners to know about this DVIP program?
That it is always available to anyone who needs it. All they need to do is call. All they need to do is go online and ask for a consultation. They are prioritized. They are truly the VIPs of our traumatic brain injury program.
Well, thank you so much for sharing. I mean, what a wonderful program. And I wish you continued success. I really do. Thank you for sharing this.
Thank you.
All right. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about concussion or the DVIP program, visit wvumedicine.org/concussion. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Cárdenas and everyone at WVU Medicine, thanks for joining us.